Hi there and welcome. My name is Dr. Marlena Jabara, and I'm the proud founder of RadPodSquad. The RadPodSquad Fellowship offers an immersive learning experience tailored specifically to podiatric imaging. RadPodSquad combines comprehensive curricula, cutting-edge techniques, and on-demand access to training that will provide you with the new knowledge and skills that you need to boost your confidence in imaging and truly make a difference in treating your patients. Check us out today, radpodsquad.com. Let's get our terms straight. When we talk about hindfoot alignment terminology, valgus rear foot is when the calcaneus is moving away from the midline. So if this is the great toe and this is considered the midline and that is your vertical axis, the calcaneus is noted to be moving away from the midline. Opposite the varus, if this is the great toe, we notice the calcaneus is moving towards the midline. So the deviation of the calcaneal lines either away or toward denote valgus and varus. Echinus position is when there's a superior elevation at the dorsal aspect of the foot, the posterior aspect of the foot with respect to the calcaneus. So you have this plantar flexion that occurs with the anterior end being lower. Echinus position also may refer to persistent plantar flexion of the entire foot, so not just a portion of the foot. Oppositely, calcaneus position is when you have an increased vertical attitude of the calcaneus where the anterior end is higher than the dorsal end. And of course, cavus foot, increasing the depth of the plantar arch that's forming between the calcaneus and the metatarsals, pes cavus. Looking at forefoot alignment terminology, we're talking about adduction or movement of metatarsals as a unit towards the midline. And this will be an important compensatory biomechanic that we see in rear foot cavus. As you can see here, this is metatarsus adductus where the metatarsal bases are overlapping and moving towards the hallux. This is an example of abduction or eversion, movement of the metatarsals as a unit away from and pivoting off their bases. So you can see them very well. It's a supranormal appearance of that. This is the lateral aspect of the foot, and we can see that valgus is as we're moving with the pronating the medial forefoot down to the ground and allowing the fifth metatarsal to rise up. So that's valgus or everting the foot. And we can appreciate that here if we put this hallux down to the ground and we allow all the metatarsal bases to be seen well. That's the similar biomechanical changes that occur between those two. Conversely, varus is the lateral part of the ankle. What we can see is that on the medial side of the ankle, we have the hallux, the first toe up above the ground, and we have this varus deformity that's moving the fifth metatarsal towards the base, and this movement towards the midline and varus. Of course, neutral being all metatarsal purchase on the ground. When we're looking at varus and inversion and supination, these are all synonyms. Inversion, varus, and supination, where the metatarsals are going to torque, so the soles face inward. So you can see a patient like this, where eventually this inversion, varus, and supination that's occurring is going to have the soles facing each other. Whereas patients who are everted or valgus or pronated, the metatarsals are beginning to rotate that way. They move away from the midline, valgus. Are you ready to take your podiatric imaging skills to new heights? Check us out at radpodsquad.com. Explore our online learning community. And don't forget to like and subscribe to our YouTube channel for more enriching content.